Okay, so speaking about appealing on behalf of the patient. So I recommend as best practice. Others that I've spoken with who are actually doing this recommend it as best practice in our community. Become the patient's appointed representative with the initial paperwork to include an appointment of representation form signed by the patient. Appointment of representative or appointment of representation form signed by the patient. So just get it up front. Don't wait to see if you're going to get a denial and then try to track the patient down so you can get that paperwork signed and get your appeal in, because you've got a limited amount of time to do that. So just make it part of your admission packet to get that appointment of representative form signed. Okay, so which form do you use? And again, this is going to be, this is our opinion, my opinion. The CMS 1696 form is the AOR form. So if you just search for CMS 1696, you can find it, or I've got the URL there. And that is used for something we use for traditional Medicare. But you could create a form yourself that has language that is substantially similar to the form and use that. And I would expect that the majority, especially Medicare Advantage payers, would accept that, because it's going to have probably all of the language, all of the information that Medicare requires in order for you to file a Medicare Advantage appeal. Okay, so you could try that. You could use the 1696 form for traditional Medicare, 1696 for creating your own form with language that's similar to that. You could have, your state may have some rules that they dictate what needs to be on the form or what information you need to send in order to appeal. So that's something to research as well. Or the easier route maybe is to use the form that was provided by the payer. And think about, is it required by your contract? Does your contract say you have to use their form or they won't accept your appeal? Or is it in the provider manual that says you must use their form? Or are they just providing it as an easy way for you to get all the information they'd like to have when you file your appeal? So those are just some things to think about when you think about which form do you use. There's not, again, a hard and fast answer to that. It's different things that you should consider. Do you want to have one form that you use for all of your payers? You can try that. Some of your payers may balk at it. Or have the form that's provided by the payer.